have 3 kids. My first pregnancy was devastating to my sciatic, and I did not know that there was help other than my chiropractor. That was like the thing that helped me. But it was so bad that I couldn't walk sometimes. My pain was horrendous.
Yeah.
So for someone, let's just talk about this. Like, what is normal versus not normal as it pertains to pain during pregnancy? Not even talking about after, like during pregnancy, what's normal and what's not normal?
I would say this, the textbook answer is truly that you should not have any pain during pregnancy. And I say that because if you experience pain during pregnancy, you should speak about it to your doctor or your midwife, whoever's following you. And then they can help you tease it out. Okay, so let's say you're having some cramping in your uterus as you transition from first to second trimester. That could be a sign of a growing uterus, and that could be in the category of normal.
Got it.
But I would want you to talk to your midwife or OB about that and not just say, oh, normal. You know what I mean?
Yeah. The thing is that I feel like not every doctor, but a lot of doctors just say, oh, that's normal.
Yes.
Oh, that's normal. But how do they know that that's normal when they don't? Like, I feel like there's not even questions being asked to assess my level of discomfort.
Yeah.
So what would you say about that?
Right. Oh, absolutely. Yes. And I mean, I would even say in the realm of what's normal during pregnancy, I mean, you can have growing pains. You can have times where your abdominal wall feels tight, and that can be painful. And that's just a sign of growing. So what I would say is if you're having any kind of discomfort or pain, you want to talk to your care provider, and you would hope to hear questions like, how bad is the pain? Sometimes you can say 0 to 10. 0 is no pain at all. 10 is worst pain imaginable. I'm going to the ER because I cannot tolerate it. And then if you give anything north of a 4, you should really do something about that. You should not be at home dealing with a 5, 6, 10 out of 10 pain because somebody told you that was normal.
And the other part that feels confusing is going to the doctor and asking about what exercises can I do, like what level of, they just say, oh, be careful, like do it, but like just be mindful. I'm like, what? It's like weights mindful?
Right.
It's like,
so can I squat? Like, where am I at?
Yeah,
absolutely. I think this is one thing that deserves so much more education, because even still, so I can tell you specifically, a good decade ago, one of my very first patients that I had in the clinic for pregnancy pains, she shared with me what her OB office told her. So when she was saying she had pains, they did refer her to physical therapy. I had gone to that physician and said, hey, this is what we do. The very next day she comes in with her complaints. He says, yes, go to physical therapy. She then asked, okay, so should I stop working out? Because this chick was like CrossFitting, running, she was doing all the things. And so she said the nurse told her, yes, you can work out with 5-pound weights overhead. And I was like, that is specific, but not for this woman. Like, what assessment was done to know that you could actually successfully do that with 5-pound weights and not disrupt your abdomen or your pelvic floor? And she's like, oh no, 0. Like, this was just a conversation. I'm like, oh, so this is standard advice that is doled out to anyone who calls and is pregnant. And it just gave me a little window into their attempt at making it clear. So that's clearer than saying, be careful, go easy. Sometimes they'll say, just go for a walk. And they're like, walking hurts. So yes, 10-pound weights, 5-pound weights overhead is clear, but it's really not appropriate.
For everyone.
Yeah, absolutely. And we do a thorough assessment head to toe to know what is appropriate. And we watch your body perform these exercises and we say, heck yeah, go for it, go for it. Did you feel that? Did you see how you did rep 7 and your abs went whoom? That's poor control, or that's where your limit is for endurance, and we need to keep it right here, maybe for a week, maybe for a month, but then we're going to check again. And then when we come back next month and we say, you can do a whole 3 sets of 10 with that and be successful, we're taking you to here now.
Got it.
Like the depth of clarity and specificity that we get to when it comes to an exercise program for pregnant women is bar none. Like, we go above and beyond to make sure that not only do you feel good with the exercises, you're performing them well, but that your body is thriving and steadily improving with what you're doing.
That's beautiful because it feels as if it's not just copy paste.
Correct. Yes.
And like that makes me feel a lot more yeah,
absolutely.